There is a lot of terminology having to do with pathophysiology, and it's good to know the terminology so you can communicate with others in healthcare professions. And so you can know what we're talking about in this class with regard to different diseases. So all the terminology that we discuss here is going to weave its way throughout the rest of the things that we discuss. So it's definitely worthwhile to know these things, know this terminology. So our learning objectives for this section are to define the basic terminology that we discussed in this lecture. And there's a whole list in the module of terminology you should know, and we'll talk about it here, to list different types of disease manifestations, to be able to discuss the terms of epidemiology, including incidence, prevalence, epidemic, and pandemic, our favorite word, differentiate between acute and chronic disease, and to be able to compare and contrast acute versus chronic disease. How would you decide if a patient you were treating had acute or chronic symptoms? So we'll talk about it. So we are going to discuss things on an organ or system level, which is considered the gross level, and on a cellular level, which is the microscopic level. So when you take a course that's called gross anatomy, it doesn't mean that it's gross. It means that we're going to look at things on the organ or system level. And usually when you take like a cadaver anatomy class, that's considered gross anatomy. When you take microbiology or histology, where you're studying tissues under the microscope, that is on the microscopic level. So a biopsy is where they excise a small amount of living tissue and they examine it under the microscope. And we'll talk about the cellular adaptations of disease and what we expect to find in a biopsy, whether it's normal or abnormal. An autopsy is the examination of the body and the organs after death. So an autopsy obviously isn't a medical treatment. It's not something that you're going to find out about something that's going to be able to help you. It might be able to help other people that have the same disease, but a lot of times, a lot of things are found out in autopsy. Like you can't just cut open someone's brain and look and see what's in there, but in an autopsy you can, and maybe find out what the pathological changes were for that particular disease. And the other times they do autopsies is forensic autopsies, which is where they're trying to legally determine the cause of death for court purposes, you know, that sort of thing. So there are different reasons for doing autopsies. One of them is, you know, medical investigation, and one of them is legal. So there's lots of different terminology that's associated with the disease process. So the diagnosis is the identification of a basic disease. So basically the healthcare provider, whether it's a doctor, nurse practitioner, or physical therapist, is going to evaluate the signs and symptoms of that this patient is presenting. Laboratory tests might be run, imaging might be done, and the idea is to determine what the basic disease process that's going on is. So I think we're all hopefully pretty familiar with the term diagnosis. Etiology is what caused the disease. So it's the causative factors of a particular disease. And lots of different things can cause disease. It can be a congenital issue, so something you were born with, or something that happened before you were born. It can be an inherited or genetic disorder. And in one of the chapters towards the end of this quarter, we'll talk about the difference between congenital and genetic disorders. It can be caused by microorganisms. So a virus or a bacteria can be the etiology of a particular disease. So of course, viruses have taken up a lot of our lives in the last few years because we're talking about them, thinking about them, and trying to avoid them all the time. It could be an immunologic dysfunction So it could be an allergy or an autoimmune disorder or something like that that causes disease. Degenerative changes, so something like arthritis is a degenerative change. Degenerative disc disease, anything that's sort of wear and tear on your body or things that happen as you get older can be degenerative changes. Malignancies are, of course, caused by tumors or cancer. Metabolic or nutritional problems. So nutritional deficiencies can be part of this. Metabolic problem could be something like diabetes or excess or loss of growth hormone or something like that. So that can be just an inherent metabolic problem. Trauma, burns, or environmental factors. So trauma causes a lot of problems and other environmental factors. So lots of things that can cause disease. And when we classify the individual diseases in this course and in other courses that you'll take, we'll talk about the etiology of the disease. So normally we'll talk about what's the etiology, what's the pathology, what's the treatment, what are the signs and symptoms. So that's commonly how we're going to classify the individual diseases. So the causes of disease, the etiology of the disease can be, we'll say, like, we know that the etiology of a certain disease is the degeneration of certain cells, or that's the pathology, but what causes it? If the cause is unknown, it's known as idiopathic. And one of my friends and longtime coworkers, she says idiopathic is short for idiot pathology. The idiots don't know what causes it. So that's a nice way to remember it. So idiopathic is, they know kind of what's going on or how to identify the disease, but they really don't know what the cause of it is. So Parkinson's disease is an example. MS is an example. There's some theories developing as to what causes it. A lot of diseases are multifactorial, but basically they don't know what causes it. So it's idiopathic. Iatrogenic is a disease that's caused by a medical error or a treatment or a procedure that causes the disease. So it could be that you were accidentally given the wrong medication and that caused a problem. So your problem is iatrogenic. It could be that you have a problem that was a side effect of treatment of something else. So a good example of that would be if you have to have your thyroid or part of your thyroid removed because of cancerous growth or anything like that. It's the parathyroid gland is on the thyroid. It's very hard to distinguish where it is. So a lot of times you lose parathyroid when the thyroid is excised. And so that's iatrogenic. It's caused by the treatment for the other problem. Predisposing factors are things like your age, your gender, inherited factors, the environment that you're exposed to that predispose you to particular diseases. So there are particular diseases that you're more prone to, you're more predisposed to when you're older or when you're younger. If you're male or female, your genetic inheritance might predispose you to particular disease. So all of those are predisposing factors. Or the fact that you work in a chemical factory, that could be a predisposing factor for later on kidney failure or something like that. Prophylaxis is a measure that is taken to preserve health or prevent the spread of disease. So a really good example that a lot of us have experienced lately is wearing a mask. So wearing a mask is prophylactic to catching an airborne illness. So other things that might be prophylaxis are when your cardiologist has you take a low dose aspirin every day to prevent buildup in your arteries or to thin your blood a little bit. Anything that is done to prevent the spread of disease or preserve your health. So it's not treating an existing problem, it's trying to prevent a new problem. Prevention also include vaccinations, dietary and lifestyle modifications, prevention of potentially harmful activities like skydiving without a helmet, skydiving without a plane, that might be dangerous, skydiving without a parachute. Anyway, I don't know how I got on that skydiving thing, but anyway, so like wearing a helmet is prevention. Wearing your seatbelt is prevention. Eating a healthy lifestyle and getting enough sleep is prevention. Hydration is prevention. Vaccinations are prevention. So those are all good things. We like them. So when we start to talk about the characteristics of disease, first we talk about pathogenesis, which is the development of the disease. How does this come about? What happens? And we'll talk about the cellular changes that happen with result to disease and what causes some of those changes. So how does this disease develop? Is pathogenesis. The onset of the disease can be sudden, which is considered an acute onset, or it can be insidious, which is gradual and you have vague or mild signs. So usually if you say that you catch a virus, viruses, can't avoid them. Oh, well, you can, but the onset can be sudden within days and it's acute. It's happening right then. If you have something like arthritis, it's going to be gradual over time. Like, oh, first your knees just kind of feel a little stiff in the morning. And then, and that's just only occasionally. And then maybe they're kind of stiff some days and they're really kind of painful other days. And sort of vague or mild. And then it gets worse and worse, and to the point where you feel like you need a knee replacement. So it's insidious onset. You don't get to the point where you need a knee replacement overnight, but you can get sick with an acute disease overnight. So acute disease is short-term. It develops quickly. It might be accompanied by signs like high fever or severe pain. Chronic disease develops gradually. The symptoms tend to be milder. They're often intermittent symptoms with perhaps acute episodes. So chronic disease is gradually over time. Acute disease is short-term and develops quickly. So when you're starting to get sick, there are some different stages of getting sick, basically. And I think we've all experienced them with things like colds and other illnesses that we've had. So the subclinical state is that there are pathologic changes, but no obvious manifestations yet. So something's going on in your body and changing, but we don't have anything we can measure yet. So no obvious manifestations. A latent state is there are no symptoms or clinical signs evident. In infectious diseases, that's known as the incubation period. So that's the time when you have the disease, it's coming on, but you don't have any signs or symptoms yet, and nothing, you can't tell you're getting sick, and nobody else can tell you're getting sick either. The prodromal period is the early development of the disease. You have either non-specific signs or absent. That's sort of like one of those days when you just don't feel right. You're like, I don't feel sick, but I don't feel well either. So sometimes people who are very aware of their health status can sense this prodromal period. They go, I feel like I've got something coming on. Okay. When you finally get past that into the clinical state, you have manifestations of the disease where you have clinical evidence with signs and symptoms that can be measured and reported. So a sign is something that you can measure. So it's like fever, higher blood pressure, higher heart rate, things that can be detected by lab tests. A symptom is something that you report, like nausea, headache, something like that you can't measure with a test. manifestations can be local, right at the site of the problem, or they can be systemic, like general indicators of illness, like fever. So when you get the clinical evidence with signs and symptoms, you know that you are truly in the clinical state, you have that disease, whatever it is. So signs, they're the objective indicators of disease. We can measure them, we can test them. Sometimes we can see them. Symptoms are the subjective feelings. We can feel them and we can report them. But it's not something that's measurable. Like when someone says they're nauseated, you can't measure them. You can't measure nausea, but we all know what it is. And headaches, you can't measure headaches, but we all know what they are. Lesions are specific local changes in the tissue. So there are certain diseases that are associated with particular lesions, and we'll talk about all sorts of different lesions throughout this. A syndrome is a collection of signs and symptoms that sort of go together that might indicate a particular disease process going on. So there's certain diseases that have clear signs and clear tests that you can test for. And there's some syndromes that maybe there's not a clear test that you can test for it, but you can look at the collection of signs and symptoms and say, yes, this fits in that box. So diagnostic tests can be various laboratory tests that are appropriate to the manifestations and the medical history for the person. So it's up to the healthcare provider to determine which tests are going to be run. And they also use that as information for their diagnosis. So the thing that I always say about tests is tests are great. Tests can kind of direct you in the right direction, but tests are not treatment. Getting a test isn't going to make the disease better. It's just going to give you more data for diagnosis. So a lot of times people, they really want to get imaging, they really want to get an MRI or an X-ray or something because they feel like they need it, but the test isn't going to make the treatment better. It's just going to give you clues as to what treatment you might need. So the course of a disease, the course or the progress of a disease can be marked by remissions and exacerbations. So remission is a period in which the manifestations subside, and an exacerbation is a worsening of the severity. So a lot of people make the mistake of saying exasperation. That's something completely different. Exacerbation is the worsening of the severity of a disease. So there's certain diseases that part of their characteristics are remission and exacerbation periods. Things like fibromyalgia, rheumatoid arthritis, multiple sclerosis often has remission and exacerbation periods. There's a particular type of MS that's called relapsing remitting MS. So, and we'll talk about that in another section. But cancer is another one that may have worsening of severity and then remission of the manifestations. A precipitating factor can be a condition that triggers an acute episode. So for someone with MS, like say they're in a remission period, and then they are exposed to extreme heat or extreme fatigue, and it triggers an acute episode, it triggers an exacerbation. Or maybe they have a change in medication that triggers it. So the precipitating factor is the condition that triggers that acute episode. Complications can be new, secondary, or additional problems besides the original disease. So diabetes is a disease that has a lot of potential secondary complications, like peripheral neuropathy, damage to nerves, like vision problems because of damage to optical nerves. So there are a lot of potential complications for certain diseases. So therapy, whether it's drug therapy, surgical therapy, physical therapy, any kind of therapy is a measure to promote recovery from a disease or slow the progress of a disease. So anything that is, any measures that are taken to do that is considered therapeutic. Sequelae, which is the plural, sequela is the singular, they're potential unwanted outcomes. So say that you were in a car accident when you were 18 and you suffered some whiplash. Well, and then years later, you started having chronic neck problems as a result of that original accident. So that the chronic neck problems are sequelae to the original accident. That's what the ultimate cause was, but it doesn't happen right away. It happens later on. Convalescence or rehabilitation is the period of recovery and a return to a healthy state. So yay. A lot of times in physical therapy, we are working with people during their rehabilitation. We want to return them to as much as possible to their pre-morbid state, and that's what we're there to help them with. So the prognosis is the predicted course of the disease. So we'll say things have like a good prognosis or a bad prognosis, and it depends on what the projected course of the disease is. These are terms that are associated with prognosis. The morbidity is the disease rates within a group. So if we say that someone has multiple comorbidities, it means they have lots of other diseases going on. So sometimes, I remember one time when I was in school, I was at one of my clinical assignments, and I was reviewing someone's chart ahead of time. It was an inpatient setting, and so reviewing somebody's chart, and they had a list of diseases as long as my arm, multiple comorbidities. So people with multiple comorbidities have higher risk and a worse prognosis because they've got so many disease processes going on in their body. So sometimes you'll see people that have multiple comorbidities. Mortality is the relative number of deaths resulting from the disease. So there's some diseases that a lot of times they'll talk about the mortality rate of a disease. So how likely is it to kill you? So low percentages are better, of course. A lot of times you can see whether better treatments are being used for a disease by a reduction in the mortality. So about probably 20 or 30 years ago, the mortality for leukemia was very high. It was above 75% of people who had leukemia would die. And now, because the treatments have improved a lot, the mortality for leukemia is much lower. It's in the low percentages. And so you have a much better chance of surviving because the treatments are better. We already talked about the autopsy being the postmortem examination. Epidemiology is tracking the pattern or occurrence of disease. So there are a lot of data collection centers. The World Health Organization and the Centers for Disease Control in the US they collect data on patterns of diseases, and they try to determine kind of what's going on with a particular disease or group of diseases. So there's some terminology associated with that, with the occurrence of disease in epidemiology. The incidence of disease is the number of new cases in a given population within a given time period. So we can say this number of people developed this disease within the last month. And a lot of times, like with COVID, when they're tracking case rates, incidence is a very, very relevant number. And it's usually the number of new cases within 100,000. So they'll say 1,000 within 100,000 or 7 within 100,000. That's the incidence of the disease within a given time period. Prevalence is the number of new, old, or existing cases within a given population and time period. So we can say this year, there are X number of people with Parkinson's disease in the United States. So that's our given population, our given time period is this year, and it's new, old, or existing cases. So incidence is just new cases and prevalence is everything. Epidemics are where a higher number of expected cases of an infectious disease occur within an area. So if you have a very high rate of a new disease that's considered an epidemic. A pandemic involves a higher number of infectious diseases in many regions across the globe. Of course, we're all sick of that word, right? But epidemics are usually where we have like a number of expected cases. Say during the flu season, the number goes up. So this is a graph showing prevalence and incidence. And the big peak on the graph is an epidemic, which is a large temporary increase in the number of cases. So, and usually prevalence and incidence are reported within 100,000 people of the population. So the prevalence and incidence are going, the graphs are going to look the same. Prevalence is going to be higher because it includes old cases as well. Incidence is just the new cases. So they're going to have a similar pattern because incidence contributes to prevalence, but incidence is always going to be lower because it only includes the new cases. So hopefully that makes sense. So communicable diseases are infectious diseases that can spread from one person to another. So the picture of this guy sneezing, that right there makes you want to put a mask on, right? Put a mask on him to keep those droplets from flying all over the place. So we've been dealing with a disease that is transmitted by respiratory droplets. This is a really good picture of the transmission of respiratory droplets. So you can see how a mask can prevent those droplets from spreading. Notifiable or reportable diseases are diseases that have to be reported to the physician or to public health authorities. Varies with local jurisdiction. The required diseases that need to be reported may change over time. And reporting is intended to prevent further spread of the disease. So at the very beginning of the COVID epidemic or pandemic, there was a lot of tracking, contact tracing, that sort of thing done by local health authorities to try to limit the spread of the disease. But now that vaccination is more widespread and so much of the population has been affected, it's not really reportable right now. And now people are testing at home too. So the actual reported cases is probably a lot less than what the actual new cases are, because people are testing at home and having milder symptoms after being vaccinated. So they're not necessarily going in for medical care.